patient in our ward with hypothyroidism or hypothyroidism, we are very confused that is it hypo or hyper. So in this video we are going to learn about hypo and hyperthyroidism and just discuss in this video. So good morning everyone, welcome to Nursing Professionals. In this video we are going to understand hypothyroidism and the hyperthyroidism, what are the signs and symptoms, what are the treatment, how to diagnose, etc. Before moving ahead, we should know where is the location of the thyroid gland. Thyroid gland is present on the sides of the trachea. There are two lobes, they are connected with the isthmus and they are beneath the cricoid cartilage. I am again repeating, they have the two lobes on the sides of the trachea, they are beneath the cricoid cartilage. It's a butterfly, or you can say the bow-shaped structure is there. Okay, so now talking about the hormones they are going to produce. Thyroid gland produces T4, T3 and calcitonin. Here I am not talking about calcitonin because it doesn't play any role in metabolism, so we are talking about T4 and T3. T4 is the inactive form. This 80% presenting 80% strength, and the T3 is 20%, but it is an active form. So whenever we require T3, there should be conversion from T4 to T3, then only we can use the this T4, right? So when the thyroid gland is underactive or there is slow production of thyroid hormones, then the patient is having hypothyroidism. And another differential diagnosis is Hashimoto's disease. It's an autoimmune disease, right? And when the patient is having hyperthyroidism, the patient is having Graves' disease, or you can say it's a autoimmune disease. And you will also find thyroiditis or patient having thyroid cancer, goiter. Okay, you will see in hyperthyroid condition. Now just see in this diagram the patient encountered with this hypothyroidism, what all signs and symptoms you will see in this patient. Just remember that the patient is having hypothyroidism, the patient would be more chubby, puffy, okay, but in hyperthyroidism patient is very lean, thin, right? So and the sign and symptoms you will see in hypothyroidism patient are following, like patient is heart rate is going to decrease, and patient GI function is going to decrease, respiratory is less, respiratory rate is less, temperature is low, and there's decreased BP, and the patient is having depression, fatigueness, and patient is very poor tolerant to cold. Now also the patient is having increased weight gain because the metabolism is not that as normal, and because the slowing down of all the activity of the body, and the voice becomes more hoarse, right? So these are you will find in hypothyroidism patient. Now in hyperthyroidism patient, the patient is having decreased TSH secretion, so there is overactive, decreased TSH secretion, but other hormones are more. So in this in hyperthyroidism patient, you will see increased albumin, exophthalmos, there's heart rate is increased, GI function is increased, perspiration, palpitations, there are fine tremors of hands, poor tolerance to heat, and the patient is having weight loss. And so patient, you see the patient is very thin, but there is exophthalmos is there. Okay, so now if we understand this thing that hypothyroidism, there's different types of hypothyroidism and how the thyroid hormones produced. There is, just see in this diagram, there is in the brain there is hypothalamus is there, that is trigger our anterior pituitary by releasing one hormone, that is TRH, is thyroid releasing hormone. By this, then this pituitary hormones, then it triggers by TRH, and then TSH is produced by the anterior pituitary, and then TSH triggers the thyroid gland to produce the hormone. They produce the thyroid. Okay, so for the diagnosis purpose of hypothyroidism or hyperthyroidism, we are taking early morning fasting blood sample, and we are investigating for free T4 and free T3. We can say FT4, FT3, T4 hormones, T3 hormones, and the thyroglobulins. Thyroglobulins for detecting any thyroiditis or for the treatment of thyroid cancer, right? So this is the diagnosis part. Coming to the treatment part, what we are giving in the is hypothyroidism or hyperthyroidism patient. We are giving, when the patient is in hypothyroidism, we are giving levothyroxine tablets 1.6 microgram per kg per oral daily. And there are two things that are really very important to notice, that it should be taken 30 to 60 minutes before breakfast, and second is it should be taken this as empty stomach, but it should not be taken with the proton pump inhibitors, any iron supplementations, calcium salts, and the glucocorticoids, because it causes any the drug interactions, right? So this is very important. And another thing is that in pregnant ladies we should also check for this hypothyroidism or hyperthyroidism, because this can interact the delay in the development of the fetal nervous system. So now what the treatment for hyperthyroidism? For hyperthyroidism we are giving this propyl thiouracil or methimazole. These medications we are giving, and we are giving radioactive iodine 131 therapy, or we can opt for surgery. It is thyroidectomy. It may be partial or the total, depend on the size of the thyroid. So we are giving these in the hypothyroidism. So I think this video gives a lot of good pointers, and if you invest your 5 or 10 minutes daily, you could get a better results within a time. I'll catch up with your next video. Till now, bye.